I'll go ahead and get started if you guys are ready. I do want you to be able to get some lunch and everything, so let me just make sure this mic is working. Hello, hello? Okay. Okay, so we'll go ahead and get started. Too much good stuff. When, why, and how to say no. So this is a talk that I'm going to assume everyone in the room needs. I definitely need to remind myself of this again and again as I get further into my early academic career because there are too many things to do. So, TMGS, where did this hashtag come from? This is actually, and it's kind of telling, this is a flavor of Rockstar energy drink. Okay, tons of artificial ingredients, lots of good stuff actually. It's good flavor. It's packed into one high potency energy drink. It's got like 240 milligrams of caffeine. It's insane. And technically it stands for two different things: tangerine, mango, guava, strawberry, but also too much good stuff. So it's a real thing and was kind of the inspiration for this talk, as well as all the content that you're going to hear me talk about. So, I am Mary McLean. I'm an assistant program director at Advent Health East Orlando in Orlando. So thank you for coming today and bearing with us on the last day of the conference during your lunch hour. So I will get you out of here in time to go get some lunch. All right, I have no financial disclosures. Okay. So I'm going to assume that we have people in various different stages of their education, training, and career in here. We've got medical students kind of, broaching the end of their medical school years. We've also got residents. You've maybe got some chiefs in here, and then we've got a bunch of folks who are out in the attending world already and maybe have been for a little while. You have been working your entire education, training, and early career to build this giant network. Whether you intended to be doing so or not, you know a lot of people now. EM is a small world, so you have a lot of contacts, and you have a lot of people who you can call on and who can call on you when they have a new project that they want help with. So this is the time that is just the epitome of your ability to cash out on the networking that you have been doing this entire time. And that's most of the time a good thing. But I will make the argument in this talk that sometimes it gets to be a little bit too much. So there are tons of things that we can get involved with in emergency medicine. Now just think, there is research, volunteering, leadership, education, public speaking, even political advocacy, and tons of other things. Lots of things. But if you do too much of it all at once, it can be hashtag TMGS. So just keep that in mind. If we say yes to everything, like the med school mantra goes, it definitely gets to be way too much for us. And it's unfortunate that this is the mantra that's sort of driven into our brain over the entire time that we're in our education and training. But the problem is that if you really do say yes to everything, or even most things, it can get to be way too much, and it's likely to work against you. You can get pulled in too many directions, TMGS. It can be hard not to sign up for something impulsively or immediately if you get a new and exciting opportunity, even if you haven't really gotten the chance to think about it. So you might end up saying yes far too much and find yourself pulled in far too many directions, quite literally too much good stuff. It can be overwhelming. It can be downright stressful, and it can lead to anxiety. It can lead to a generally bad time. So in the vein of trying to be transparent, I will first of all let you know that I have not perfected this whole thing. This is something that I continue to struggle with, and I would venture to say that most of us do struggle with some degree of it. If you're here at an academic conference, you might be presenting something, you might be speaking in a competition, you might be participating in dodgeball, sauna war, something that is ambitious. And you might be one of these people that's like me. So I tend to cycle in and out of overcommitment and then a little bit of regret after I have overcommitted. Now it gets better and better every year of my career, but I will share a story of mine from a couple of years ago. So it was my chief resident year. I already had tons of things on my plate. projects, a little mini fellowship, speaking engagements, speaking competitions, as well as didactics. And then I was also trying to be a good mentor and a good wife, a good family member. I had tons of things going on. And then I got the chief responsibilities on top of that. So this ended up being far too much for me. And I didn't know this about myself yet, that I was prone to overcommitting and then not communicating about what I needed from the rest of my team. So I went for far too long without talking to anybody about it and without leaning on anyone for help. And when it came time for me to go on an off-service rotation that I expected was going to be an easy one, it actually was not easy at all. And I had a little bit of a dumpster fire, for lack of a better phrase. Reached out to my program director finally and a few of my mentors, and immediately felt better having that line of communication open and being able to express my concerns about what I was going through. And then also realizing that I had people there that I could lean on. But then doing some self-reflection, I also looked back on what I had done that led me to this scenario. And it was all preventable. And I would say that I prevent this from happening most of the time now by using the rules that I'm going to teach you in this talk. And they're very simple and memorable. So like I said, we overcommit, it can lead to a dumpster fire. And specifically what I'm talking about is personal stress, anxiety, even burnout, but also a decrease in the quality of the work that we're doing. It can really cause us issues. So it can cause you to be late to meetings. It can cause you to cancel meetings. It can cause you to fall through on your commitments that you used to be great at following through on. It can cause you to become unreliable and really unraveled overall. And that's not like us most of the time. So when we overcommit, it can lead to this. And everyone has their threshold. Everyone has that point at which what you have on your plate suddenly becomes too much. And up until that point, we can add more and more onto our plate without too much decrease in the quality of our work. But like I said, everyone has that threshold. And then after you reach that threshold, if you add on more, then the quality of your work starts going down. You start experiencing this high effort, low reward scenario, which is very well described in the business world, not quite so much in the world of medicine, but it's kind of the definition of those things that can lead to stress, anxiety, burnout. My threshold is different than than your threshold. Everyone has their different threshold, and as we get further along in our education, training, and career, we discover more about our own threshold. And it also is a dynamic thing that changes once in a while. I'm envious of the person that needs only 4 hours of sleep a night, but that is not me. So what does this look like, though, in terms of stress, burnout, anxiety? Well, remember, we got into medicine in the first place to connect with people, to create relationships with people and patients, to challenge ourselves, but to do generally good work. I have to believe that all of us in this room have an altruistic reason for having gotten into medicine in the first place. So if you are overcommitting, though, to the extra stuff, and a lot of this stuff is extra, we're talking research projects, volunteering, it's good stuff, but this is not necessarily the direct patient care that you went to medical school to learn how to do. So if we are overcommitting to this extra stuff, we can easily lose sight of what we came here to do in the first place. So don't let the extra get in the way of you being a good doctor, of the whole reason that you came here. Because it can become hard to take care of other people if we can't even take care of ourselves, if we are feeling this overstress and this burnout due to overcommitment. So let's talk about some of the physical effects, and I'm not going to belabor this point because it's a well-studied research, but this is not a molecular biology topic that I'm going to go into, but there have been numerous studies that have looked at overstress and overcommitment at work and associated these tendencies with changes in cardiovascular sympathetic regulation, which is a risk factor for cardiovascular disease. There are also studies, one that came out a little bit earlier this year, that even found that work-related psychosocial stress was related to global cognitive function in terms of such things as telomere length and low-grade inflammation over the long term. So these things are real, they happen. And there's another study here, overcommitment to work is associated with vital exhaustion. And there are studies that have found vital exhaustion is another risk factor for cardiovascular disease. So we've got lots of kind of molecular biological evidence that tells us this is bad for us physically. We need to be listening to it. And that's aside from all of the psychosocial stressors that come up when we have overcommitted ourselves. So suddenly you've overcommitted. All of these great and vibrant extra things that you're trying to do with your time outside of the clinical environment suddenly won't feel so great, and they won't look so valuable both to you and to all the people around you, to your teammates. We know this, and yet many of us still tend to cycle between overcommitment and eventual regret, and we do it over and over and over again. And again, in the vein of being completely transparent, I still do this. It's better and better every year, but I still do it. So why is it so hard to say no? Well, think about our demographic. Every person in this room worked hard to get where they are right now. We are overachievers. We are natural helpers. We run into the fire and we put the fire out, and we are used to that. That's what we've been practicing in our daily lives and our careers. We keep our word. We have this internal pressure to do well, and we also feel the external pressure to do well from the people around us. And we have a fear, whether it's warranted or not, we have a fear of what people are gonna think of us if we tell them no. So, all right, let me give you some real world recommendations for how to mitigate this for yourself in the future. And I'm not saying that I'm going to cure your remedy. I'm not going to cure the problem here, but I am going to give you some tools in your toolkit that you can use to make it better for yourself. And it's very simple. So, okay, so there's a new opportunity, but I'm too busy. What should I do? So, what if it's an easy decision? If it's a no-brainer? That's not really what we're going to be addressing in this talk, because most of these decisions aren't necessarily a commitment that you're going to make immediately or not at all. So if it's an easy yes, then, if it's just an opportunity that you can't pass up and you know it right away, then all right, say yes. But also note from the beginning that you might have to ask for some help reallocating the things that are on your plate right now in order to make it possible for you to do a good job at this new commitment. And we'll talk a little bit more about how to do that in a second. What if it's not such an easy question? This is where you have to do a little bit of pre-work on yourself. You have to think about where you want to go in your early career, in your later career. You have to think about where you want to be and what you want to be doing 1 year, 3 years, 5 years, 10 years from now. So some of us may want to go into community medicine. Some of us may want academics. Some of us want admin, some of us want locums. Maybe if you're in residency and you're coming up on graduation, you're thinking about fellowship, but you're not really sure. You might just want to go straight into the workforce. So it requires a little bit of pre-work and soul searching, a little career soul searching is what I like to call it, before you are confronted with a scenario in which somebody's asking you if you want to commit to something. So I would recommend that when you go home tonight, or when you're on your flight back to where your home is, just make a little list and write down the things that matter to you in your career, things that that make your day go well when you're on a clinical shift or when you're doing those extra things outside the clinical environment. And see, like really do some career soul searching, figure out how you're going to incorporate that in your career and where exactly you want to go in terms of these different options or the many others that are out there. All right, after you've done that, say you're presented with a new opportunity from a colleague or a friend who wants to get you involved in whatever they're doing. What I like to talk about is the 24-hour rule. This is so simple, and it's made such a drastic change in my life, and I am really excited to share it with you. So this is, if you are offered an opportunity that involves commitment of your time, what you want to do is resist that urge to commit immediately or to say no immediately, except in that minority of situations that are no-brainers. For the vast majority of these opportunities that come up for you, you can take 24 hours to think about it. And I think we underestimate how important those 24 hours are. We don't want to make these decisions impulsively. When we make these decisions impulsively, that is when we overcommit, and that is when we have trouble shuffling things on our plate around or offloading the things on our plate, because it just seems so simple to the people who are offering it to us. Of course they have extra time. Of course they can do this with me. If you take that 24 hours, number one, it gives whoever is offering it to you the impression that you are giving it some serious thought, which is flattering. That's almost like a compliment. If you're spending that time to really figure out if you can do it justice, that's great. And you know, the way that this is going to look in practice, say, you know, your medical director comes up to you and asks if you want to be a part of a QI project that, you know, maybe it's a little bit up your area of interest, but it's not quite the perfect match. You already have a ton on your plate. You say something like, wow, that sounds like such a great opportunity. Thank you for thinking of me. I have a ton on my plate right now. I want to figure out if I can do this opportunity justice if I commit to it. So give me 24 hours or one day to think about it, and I will get back to you. And then the important thing is that you do get back to them ultimately. And again, this is a method that you can use for most opportunities that you're offered. So I do want to give you some cautions if you're using this rule. Number one, don't use the 24-hour rule if it is so far away from something that you know is in line with what you want for your early career. There's not a whole lot of point in taking time to think about it, and you know, you may even forget to get back to them. It's just another thing on your to-do list of things that you have to list out, and that becomes a burden for you to remember. But more importantly, don't use the 24-hour rule if it's an incredible opportunity that might go away during that time that you're trying to think about it. So if you get offered, I don't know, a position on a multi-million-dollar NIH grant, that is something that you know you want to be doing research-wise, you might want to think about using the 24-hour rule as opposed to just immediately and wholeheartedly committing right away, knowing that you have to shuffle some things around on your plate a little bit later. Caution if it's an opportunity that you've been waiting for. So if you've been thinking about that NIH grant already and you were just waiting for the opportunity for somebody to offer a position on a grant application for you, then you've already kind of thought about it for more than 24 hours. So there's probably not a whole lot of utility in using the 24-hour rule. And then be careful if it's something very competitive and somebody might swipe it up in the next 24 hours. And then also be really careful if it's something that's actually part of your job description, and it would behoove you to clarify with your medical director in this example whether or not it's something that is really expected of you before saying something like, I don't know if I can do that. Give me 24 hours to think about it. So obviously. Okay, so Say you use the 24-hour rule and you figure out, yeah, it's worth it for me. What does that look like? So what you say is, I really want to do this. Help me figure out how to free up some time to make this work so that I can do justice to it. Remember, you already have a lot on your plate, and there's no time like early on to express that to whoever you're going to be working with on this new commitment. If it actually is not something that you want to commit to, then there is a really sensitive way that it can be worded. This isn't just a simple no. It's really important how we tell people no. And obviously that's the title of the talk. So I really want to give you some details on this. What you want to do is thank them for thinking of you. You want to validate that it's a worthwhile project, and you also want to recommend a colleague rather than just saying no and putting up a roadblock for your colleague. Let's talk about another example. So say you're in, your second year of residency. You've done your career soul searching. You already know that you want to go into medical education. You're running for chief resident. Your plate's already pretty much full. You've been doing research and quality assurance projects. You've basically got all the boxes checked on what you need to accomplish before graduating from residency. And you're also applying for fellowships. So one of your colleagues comes up to you and says, I have an awesome idea for a new research project on ED operations and workflow. Do you want to spearhead this new project for our department? Because I don't have time. I think you'd be great. Okay. So now we have a new opportunity from a colleague of ours, and it's not in line with where we want our career to go, which was medical education and probably a fellowship. And we're already super, super busy. So if this is if you utilize the 24-hour rule, you think about it, and you formulate the way that you're gonna say no to your colleague, the way that I would say this is, thank you so much for thinking of me on this project, because it means a lot that you reached out to me and thought that I'd be great for it. So I have so much on my plate right now. I don't feel like I can do justice to your project, and I think that somebody else, specifically, Chris over here, might be a much better person to ask, because he is really passionate about ED operations and workflow, and I'm trying to go in more of a direction of medical education. And again, I have so much on my plate, but thank you for thinking of me. It means a lot. That's the right way to say no. Okay, so it's rare, though, that a perfect project that sort of checks all of your boxes is going to randomly fall in your lap. So you also have to be aware that you can create your own project. You can create your own opportunities. And the way that I like to talk about doing this is to map out any combination of niches that you want to have in emergency medicine. So, for example, for me, I was interested in residency leadership, medical education, and research. And there are ways that you can kind of create your own Venn diagram and make a project that incorporates all of those things that you're passionate about. For me, it was research, it was medical education research for residents, and I worked with the program leadership on it. So it was a perfect combination. Now, what if you have already overcommitted yourself, you're feeling the stress, you're feeling the burnout, you find that you're starting to falter both clinically and non-clinically, and you're really just in a bad place. Remember that in these scenarios, you have to recognize it early, cut yourself some slack. Don't make yourself continue to do things the way you've been doing things. Reach out and communicate with your team, because that is the first step. It's really important, and you don't want to be alone in this. You don't have to be most of the time. Lean on your team. But in turn, know that at some point in the near future, they're going to need to lean on you, because everybody is always cycling in and out of these phases of overcommitment and stress and burnout. And so we need to be able to rely on one another, especially in our teams. And become a master of delegation. So that is all I've got for you today. Thank you so much for joining. Please go get some lunch, and this was wonderful. Please fill out the evaluations whenever you get a chance.